Most of us would like to think that if we fell ill or even became unable to care for ourselves, there'd be somebody there to look after us. But take a look at the headlines and it's easy to start to think that maybe that's not going to be the case always. Yes, health and social care are facing many challenges, that can't be denied.
We need to start shouting about the opportunities that we have rather than the crisis and the difficulties that we face. We've thousands of people and we've made an excellent career.
We're going to be meeting some of them in this video.
I've done this role now for 34 years and I've never wanted to do anything else.
To do the job you have to have a passion to do it. So if it's for money you're going to go in, then that's not what the job's about.
I have a deep passion for helping people and just trying to make people's lives a bit easier and be there for them through their toughest times.
Whereabouts on the face would be clean?
And we'll look at the opportunities available for those who'd like to join them.
It's not just a care worker or a nurse, there are numerous jobs available in the health and social care sector.
This is Arnside Lodge, a care home that specialises in helping people with dementia. Trish is a team leader and loves her job.
And I always say every day I'm coming to work to look after my grandparents.
That's how it feels.
And that's how it feels. They are all my grandparents.
Kaylee has worked her way through the ranks to become a registered manager.
I was lucky that I have joined a company that believes in me and that saw that I was quite eager to progress and quite eager to train.
What sort of qualities does somebody need in order to consider a career in care?
You need to be passionate about making a difference to people's lives. You need to be patient, you need to be caring, respecting people, not judging people.
But places like this are struggling to find enough Trish's and Kayleys.
I think throughout the COVID crisis that people got the wrong impression about social care, and I think it has put people off.
What would you say to persuade a young person who's thinking, is it for me?
It's about the whole package, isn't it? It's about training people, it's about getting their interest, and there is a career path to get involved with as well. So if somebody wants to be a carer, great, no problem with that, and we have some tremendous carers and they're happy doing that. Now if somebody wants to progress a career, then there is an opportunity open.
And of course, pursuing a career in social care in Morecambe means you have all this on your doorstep. But what about opportunities in the health sector here?
There was a lady in there who had 9 exacerbations of COPD.
Catherine Wan is a specialist frailty nurse with the Bay Medical Group. She works with patients in residential and care homes.
I'm currently doing some advanced care planning, so we're discussing preferred case of care, so about if patients would like hospital admission or if they want to stay at home and just have the nursing or residential treatment they can give.
So have you had your blood pressure checked recently?
Not recently.
Dr Mohammed Akhtar says there are roles and opportunities in primary care which require a vast array of skills.
We have about 225 people who work with us, but it's only a fraction of those people who are clinicians. There is a huge number of people who are in the background and making the place work effectively.
So the GPs will do a diagnosis, start people off on medications, and then we review them to make sure they're safe on those doses and they're not getting side effects. I like that we make a change to people's lives. If you get the medication right, it makes a huge difference to a long-term condition.
In health and social care, there are over 350 different career options. There are the direct clinical roles, but there's also those behind the scenes roles.
Catherine's part of the army of backroom staff who help to keep the University Hospitals of Morecambe Bay Foundation Trust running smoothly.
Anything administrative, basically, so send letters to patients for appointments, send them letters when they're on the waiting list, do a lot of registering of referrals when we get them through from GP surgeries or hospitals, so putting them onto our electronic system, and basically answer the telephone, deal with any queries, and basically anything else that the clinicians ask of me.
Hi, you okay?
Ellie Herman provides support for newly qualified doctors.
I do a lot of pastoral support within my job. They're straight out of medical school, so it is often very scary for them to come from being a student as opposed to them becoming a doctor.
So I do a lot with them.
The shortage of nurses is a well-documented national problem.
But, you know, we are looking at what we do, and internally we've got a number of really good things that we do to support colleagues into some of the most rewarding careers available in the country.
They've recruited hundreds of qualified nurses from overseas, but they still have to undergo further training here before going on to the wards.
When we're recruiting from abroad, it's quite easy because we are one of the gold standard healthcare systems in the world, and that's what these nurses want to come and work in. They really, really want to come and work for the NHS. It's trying to encourage our people in the UK that they want to also work for the NHS.
Apprenticeships are one way in which they hope to find more recruits from within the UK.
Apprenticeships combine traditional study with vocational learning, so you'll be learning on the job. So the idea is that you would be working in a full-time role and studying alongside that to qualify into your chosen career pathway.
And being paid whilst you're learning.
And being paid to learn as well.
The other thing that we're working on very closely within our organisation is T-levels. So this is a qualification aimed at 16 to 19-year-olds, and it doesn't just cover health, it covers a vast array of other career profiles.
We want to make sure that the people that work for our trust represent the community that we serve. So we invite applications from anybody with all sets of qualifications, all different types of experience. There's a job for you at the NHS.
These young people hope to make their careers in health and social care with the help of Lancaster and Morecambe College.
We look at the skills that students develop while they're on the course, such as communication, interaction, teamwork, care skills, providing person-centred care, but also students have the opportunity to go out and do work experience. So they learn all about all aspects of health and social care.
Us as an education provider will go out there and sing about our opportunities that we've got to upskill people in that profession, and we'll work with employers to try and recruit people into that profession as well, because it is one of the best professions to be in.
So what's the advice to those thinking about working in health and social care from those who are already a part of it?
So just to really not listen to what you're reading in the media or hearing on the TV, and just go for it. It's really, really good, it's really rewarding.
You've got to be able to want to do care, to be able to do care.
My advice would be to contact the local health organisations and try and organise some work experience.
There are so many career pathways, so many training opportunities, so many routes to go down that you can't get that anywhere else.
I'm 25 years down the line of working for the NHS now, and I still am very, very proud that I work and I'm part of the NHS.